Hello and a very good afternoon, everyone. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be doing really good. So, today we are talking about the essential role of moisturizers in managing dry skin disorders like eczema, psoriasis, simple dryness. If you are struggling with dry skin, you're not alone, but we all know that moisturizers are key to keeping your skin healthy and comfortable. Dry skin happens when your skin loses the moisture and can't retain enough water. This leads to rough, flaky, and sometimes itchy skin. Conditions like eczema or psoriasis make this even worse by damaging the skin's natural barrier. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. So, we'll look at how to manage dry skin from happening and talk about the latest treatment options available. So, let's connect today with our skin expert, Dr. Shamik Das, who is a MBBS, MD, prominent dermatologist and sexologist based in Beliaghata, Kolkata. He has over 23 years of experience in the medical field, specializing in various aspects of sexual health and dermatology. He is recognized for his empathetic approach to patient care and emphasizes the importance of patient education regarding healthcare options and treatment plans. He is also fellow of Council of Sex Education and Parenthood International, that is FCSEPI, based in Mumbai, which highlights his commitments to continuing education in his field. It's such a pleasure to have you with us, Dr. Shomik Das. A very warm welcome to you.
Thank you, Sangeeta, for this brief introduction, and thanks for bringing me on live. Uh, as we all know that
Yes, Doctor.
uh, it's always a pleasure to be on a show like this.
Absolutely. And I'm sure we are going to have a very informative and enlightening session with you because, this is winter. Most of us are still experiencing winter in our country, and somewhere the temperature is, going high, somewhere it's still down. But the problem of dry skin is there in most parts with most of us. So it's important to talk about it because many times we don't realize that just by skipping a very basic skincare regime of maybe moisturizing, we are actually stepping into the hard world of skin related disorders where, eczema, psoriasis, various things are there. So it's important to understand how and what is the management of dry skin. First of all, doctor, what causes dry skin?
Well, let's start with the basics. First, the basis of dry skin is not drinking enough water. For a lady, in general, it is 3 liters per day. For a guy, since the skin surface area is more, we recommend on an average 4 liters of water every day. We sometimes miss out on drinking enough water because of a paucity of availability of potable water, sometimes due to work. Sometimes we are not in the habit of drinking water. Sometimes because of lack of, basically for ladies, because of lack of proper toilet facilities, we tend to drink less of water. Uh, so that is the first and foremost thing. That is drinking water. That is the basic thing. Next comes the use of moisturizers. Skin is a kind of it's a surface area. It's the first line of defense. So it has to be well hydrated. So if we first of all supply enough water, then the question of it coming out through the skin is in prerogative. Uh, so the point is that in spite of it coming out as perspiration, be it invisible perspiration in dry seasons or be it in form of visible perspiration in the summers or the monsoons, uh, the seeping out of water, that is total epidermal water loss, that the skin slowly seeps out the water, that has to be ensured, and that has to be kept in place with the use of moisturizers. Along with that, the skin care routine on a regular basis has to be taken care of. If there are any pathologies, that has to be taken care of, obviously. In case of any diseases, that has to be taken care of. And we have to take care of the clothing as well. Uh, mm, Basically, cotton is a material which is very good for the body. It gels well with human body. So we should tend to use more of cotton products or cotton-based products during the day and at night as well. And what I recommend is most of the people should have the 90% of the water to be drunk before 7 p.m. Many people compensate the daily intake of water by drinking at night, and that leads to you running around to the toilet more frequently and coming back again drinking water and again running back to toilet. That creates a disruption of sleep. So that has to be taken care of. And along
Right.
with that, the food that we take, that has to be also taken care of, because the kind of food that we drink or eat also needs to be taken care of.
Right. So, very well, you have explained, Doctor, how important it is to hydrate ourselves, our body, by having adequate water, and how important it is to hydrate our skin by applying moisturizer, how much water, when, and of course, the quality of food that we are consuming. It all plays a very important role. But, Doctor, how? If we keep on ignoring our dry skin issues, we are at risk or increasing our risk of, stepping inside the boundary line of maybe eczema or psoriasis or atopic dermatitis. How are we increasing our risk by ignoring our dry skin issues?
Well, I'll take it step by step. First of all, comes I'll go for the other organs. See, if we drink less water, there are more chances of having a kidney stone, urinary tract infection, for your stomach to have acidity issues, for your liver to not able to digest the food that we eat, the minerals that has to be taken by the blood, that also gets hampered. Uh, Even your blood pressure or blood sugar levels are also affected by paucity of water. Coming on to the skin. Skin needs a balanced amount of hydration. It should not be too much or too less. It has to be balanced. So I mean, the conditions that you have already told, like atopic dermatitis, that leads to itching, that needs a moisturizer, that needs a good amount of water to be drank. Coming on to psoriasis, that again causes exfoliation of skin. That means the skin gets peeled off. So the more exposed the skin is, it needs more of hydration to keep it. The barrier is gone. So the exposed skin needs some kind of a hydration so that it remains thin. If it is too dry, then it leads to itching, scratching, and the damages, and it increases. Coming on to there is a condition called as xerosis, in which the skin is very dry. There are some conditions which are genetic as well as due to the work and stuff. Skin becomes dry all over the body. Uh, uh, there, the even if you apply the moisturizer, if you don't drink water, it won't compensate for it. So the dryness increases, itching increases, your whole system is goes for a toss. And thing is that the moisturizers have to be applied at a regular interval. Say, suppose you after you take a bath or you sponge yourself or before going off to bed. It depends on the climate. It depends on the individual. It depends on the age. Extremes of age, like the babies and the elderly, they need more of moisturizers. Suppose a person is staying in a air conditioned environment, that also needs more of moisturizer, because the air conditioner, not only air conditioner or a heater, it drags off the excess humidity along with the weather and the geographical location. Suppose you are in the near the seashore or in the Gangetic or near the rivers. So the humidity level will be a bit high out there. But people who are living in places which are dry, suppose hilly regions, mainly near the Himalayas, there the condition will be much more worse in terms of humidity. So you need more of hydration. So this is something that is basic and is known to everyone, but we tend to ignore it at times.
Right. Right. And that's where I'm coming, doctor. Moisturizing our face skin is one thing. Most of us do that. But when it comes to the other exposed areas, be it our hands, our legs, etc., we tend to ignore it. And especially with people who have a oily skin, because they have this feeling that I'm already secreting so much of sebum. I already have a oily skin. Do I still need a moisturizer? Now, why it is important to moisturize all the exposed body parts, why it's important even if it's an oily skin person or people who are prone to acne, etc., they also tend to ignore the whole part of moisturization because they feel it's to clog the pores further. So, why it's important even for them? Is it important for them, first of all, to use moisturizer?
Well, coming on to that, uh, just as our body has different layers of skin, like suppose it's lips, which is exposed more to, which is very thin and
Right.
exposed more to the food and stuffs and our saliva. So that needs different kind of care. Places like our face, which is a bit thicker than our lips or eyelids, that needs a different kind of care. Places like our hair and scalp, that needs a different kind of care. I'll come to one of each of them separately. Places which are covered, that needs a different kind of care. Places where we tend to use more of, say, suppose a housewife or a person who is working with water and is frequently using a soap, that needs a different kind of care. The skin of our soul, that is very thick, that is one of the most thickest part, that needs a different kind of care. And even the intertriginous places where we sweat more, there are the skin folds like our armpits, below our breast, in the groin. That needs a different kind of a moisturizer therapy. So then again, there is a personal kind of a variation. Everyone doesn't sweat the same. Everyone doesn't have the same kind of work or daily routine exposure kind of thing, and places which are exposed to sun, that needs a different kind of care. So lips are more tender. It needs a regular use of moisturizer, repeated on an interval of say 3 to 4 hours after every meal. Uh, for face, it has to be something that is non-comedogenic. That is, in layman parlance, it has to be something that reduces the acne or doesn't clog the pores, as you said.
Yes.
Places like our hands needs something thicker, uh, and that has to be applied after you wash your hand or uh, take a meal, and places like which are thick, like our feet of sole, that needs a bit of care. If you can soak your feet and scrub it with a pumice stone and once in a while, and use something like a exfoliating agent along with the moisturizer that will exfoliate the dead skin. That is needed out there. For our body, it needs something a bit thinner, like lotion that spreads even on the hairy areas. And a cream is a bit thicker, which has to be applied on a specific area of the body. Then again comes that's the most difficult place. Some people like it to be greasy, some people like it to be thin, some people need it to be to have it have a smell, kind of fragrance. Some
Fragrance.
people don't like fragrances. Some
Right.
people like it to be long lasting. Say, when I was in Europe, that time people used to take bath once in 2 to 3 days. So something, some kind of a humectant or moisturizer which lasts longer, or some person who is not able to take bath on a daily basis. Though in Indian culture we take bath daily, but lot of people take bath once in 2 to 3 days. So you need a longer lasting thing, moisturizer. And at the same time, the moisturizers have different ingredients which can give better softness. I'll come to the ingredients later. Uh, but in general, the age-old practice of taking bath after applying oil doesn't suit now. With changing times, newer things have come. The oil that we put, that we apply before bath, 90% or more of it runs away along when we take bath. So it's good for massaging. That is true, but it doesn't hydrate it beyond the time of our taking bath. So lotion or emulsion works better out there. Emulsion is that the ingredients in mixed in water, so it gets absorbed faster. Say, suppose you want to take bath and go off to work. You can't just wait for it to dry up before taking putting on the clothes. Otherwise, you'll be late for the work. Uh,
Right.
so it should not be sticky, but it should not run off as well.
Right. So we have moisturizers in almost all formulations for every skin type, etc. But why it's important, doctors? For example, if a person is suffering from any of these, skin-related issue, which is due to dry skin or what we call dry skin disorders, why it's important to go and consult a qualified dermat like you, and then only take and start applying moisturizers as per the advice, etc., and not fall for various, because these days you have tailor made, you have customized moisturizers, you have various social media influencers, preaching about skin care, and then we have various DIYs. Market is flooded with products. We have as you said, a number of moisturizers are there in the market, with fragrance, without fragrance. There's that, everything is there. But why it's important, especially for dry skin related disorders, to go and consult a doctor before using anything on their skin.
Well, that's a nice way of putting it. Frankly speaking, there is nothing like one size fits all. So,
Right.
what we doctors do, we don't do something like a rocket science. It's very
Mhm.
simple. It's very simple. What we try to do is we use dermatologically tested products. Number one, which can be used in mass, which is tested on a lot of subjects on a varied level of population. Number one. Number two is uh, we are talking of the fragrance, we are talking of the spreadability, we are talking of the ingredients, we are talking of the place that we are using, the profession, the kind of weather, the geographical location. All those things have to be taken into account. And as at the same time, there is a thing called a sensitive skin disorder in which a person is sensitive to certain ingredients. So that has to be taken care. And how much hydration do we need? Do we need more? If we make it too much greasy, then it becomes the condition becomes soggy. That doesn't heal up kind of a disease. Suppose a person who is doing a field work, doing going around running errands, doing work in the kitchen. So the morning part of moisturizer and the evening will be different.
Right.
Suppose a person is staying in a place where he or she needs a kind of a moisturizer which has got certain ingredients, which is leading that person to cause irritation. That needs to be tested. I'll give you a certain tips. Say whatever we apply on the face, we first ask any person, be it any layman, to test it on the earlobes. Wait for 2 days and then apply on the face, not just apply straight away on the face. For any part of the body, the we ask that person to apply on the forearm, wait for 2 days and see if there is redness, irritation, itching, or swelling. If these things are not there, then you can apply. So, just taking anything just by advertisement, that might suit 8 out of 10 people. But those two people who are not able to tolerate those things, they will have severe reaction. So that's the only concern. Otherwise, there is no rocket science. There is doctors are not God sent with the and we know that this will suit you. That's for sure.
Correct. And doctor, because you have mentioned ingredients many a times, we would like you to shed some more light over what are the ingredients that we should, look for whenever we are going to buy a moisturizer for us. Is there anything that we need to check out?
Well, it depends on the skin type. The newer ingredients have come out like ceramide, hyaluronic acid, nicotinamide, and there are moisturizers which are a bit greasy. There are moisturizers which are thin, depending on the kind of skin or where you are about to put it. like linoleic acid and uh, 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 your basic like palmitic acid and all that. Though the basic ingredients like olive oil and glycerin and the amount of water and all those things are uh, have to be taken care of. Like I really can't outline straight away that this particular thing suits en masse. So it has to
Yes,
be
yes. I completely, yeah,
it
I
has to
completely understand you. Yeah.
yeah
Doctor, we are getting so many questions from our viewers. I'll take few of them. So there is
sure
Deepak, and
sure
his question is: do moisturizers help with aging-related dry skin, fine lines,
yeah
etc.?
yeah absolutely. And it has to be started early on in life and has to be continued on a daily basis at certain intervals. And the earlier you start, the better, obviously, because it helps in keeping the elasticity. Obviously, there is a saying in dermatology that you age with grace. There is nothing that can reverse your clock. But only thing is that it can keep your skin supple and healthy for a longer period of time because skin has different layers. So the moisturizer, what it is doing is it's keeping it soft, supple, and it is the elasticity is maintained. I can't reverse it because your it starts in the level of bones. Then there are the soft tissues. Then there are elastic tissues, which all these sandwiches are there, which specifically the pad of fat. It gets reduced with age. I can't do anything from outside. I can't apply anything to just keep it stretched like a balloon all through your life. But all I can do is a regular mm, cleaning and regular application of moisturizer can keep it soft and supple for a longer period of time.
Fair enough. We have Kalyani with us, and her question is a thicker moisturizer better for cracked skin?
For cracked skin, thicker moisturizer is good. Sometimes we ask a person to keep it, suppose it's on the feet, we ask the person to keep it keep the feet in socks or keep it covered up, but that is not possible all through the day, and it's not possible when you're working. So the more you can keep it at specifically at the night time, the better. Along with that, there are a lot of other ingredients like urea and some other exfoliants are there, which can exfoliate the dead skin and expose the soft and supple skin inside so that it doesn't crack too much.
Okay. Yashi is here. The question is: what type of moisturizer is best for psoriasis?
Well, depends on the place of psoriasis. If it is on the scalp, it's different. You need to apply a kind of something that is less greasy and doesn't uh, alter your look. And when it is on the any part of your face, it has to be a bit less greasy. Uh, it has to be very thin, and when it comes to the psoriasis proper on the body, then you need something that is really very greasy so that it remains very soft. Coming on to psoriasis, I'll just highlight one or 2 points. Psoriasis,
Sure.
what happens is the second and third layer of skin becomes thick, but the top layer becomes gets less of the moisturizer and it chaps off. So what we need to do is we need to give a very thick, greasy moisturizer once a day, and maybe another time we'll give, medicated creams so that the thickness doesn't increase so much. And as well as there are oral medicines and other lot of stuff are there nowadays. So we need to protect the skin below. So that needs to be very thick and greasy. And I can't specify you the name because it depends on the on your geographical location, the kind of psoriasis that you have, and your doctor will be best to recommend it accordingly.
Right. So, Yashi, in case you have psoriasis or anybody known to you, please recommend them to go and consult a qualified dermatologist. It's really important. We have Ishita Javidas, and her question is: should I use a different moisturizer for mornings and evenings, night?
Yeah, obviously. For mornings, you need something that will because mornings, if you're not working in a BPO and working through the night and sleeping through the day, if you're because we have different professions nowadays. I have patients who are
Right.
working as stewards at night, or bartenders who are working at night, working in software companies who are working through the night. If you're not like that, then you need a thicker moisturizer for the night, which is longer lasting during the night, evening onwards, evening to morning. And you need something thin that gels well with your overall skin and doesn't soil your clothes, doesn't look awkward on your face. It doesn't look as if you have put on a thick layer of coating on your face or exposed areas. And uh, and the most important thing is, as I highlighted firstly in my talk, you need to drink water, enough water, at least 3 liters of water.
Right. Geetika is here. Her question is: can I use body moisturizers on the face?
Well, body moisturizers are mostly lotion based, and it is thin. If it's better that you use face moisturizer because it is more sensitive. Skin is much more thinner, so it's better that you go to your dermatologist before you take that decision. But I would rather suggest you to apply something different on the face, something that suits your skin, and whatever you apply, apply on your earlobe first, test it, and then apply on the face.
Okay. There is one more question by Ankita. Her question is: how do I choose a moisturizer for sensitive skin? And doctor, sensitive skin issue is increasing rapidly these days. People with
Yeah.
sensitive skins. So, what do you recommend?
Well, sensitive skin requires much more dermatologically tested materials, like
Right.
glycolic acid, cetylated alcohol, and uh, the I'll not say that reputed companies or costly products are only good, but the cost doesn't come just like that. It is more because of it's not only a marketing gimmick. It's
Right.
they are tested more proven on the uh, should I say subjects or should I say patients? Uh, but they have
Agree.
been tested more, and then they have been brought to market. So it's better to go for a product which is much more uh, recommended by a dermatologist for the face, because the sensitive skin, not only of the face but other areas, a lot of people are sensitive to it. So it's better to go for the products which are recommended rather than experimenting on yourself. Don't make yourself a guinea pig, please, because I face a lot of people who have applied something on recommendation uh, by the media, by friends and family, and it might not be your kind of thing. Like it's just like food. Every food doesn't appeal to every taste bud.
Right,
So,
right.
uh, so it's better that you go through that before you start applying
Right.
all over the face or on sensitive
That is
areas for that.
Right, that is one of the problem in our society. Any friend, any relative whom we discuss our issues, they'll easily pass on their prescription to us, saying that you also follow this prescription. I got benefited, you'll also get. But it's important to understand that we all are different. Our skin is different. Our skin-related issues are different, and thus, in case there is any issue, we need to go and consult a qualified doctor. Just in case we have chest pain, we just won't go to anybody and say that suggest me anything, I'll eat it and get well. We'll go to a cardiologist, at least to a physician. So take skin that importantly as well. In case you
Yeah,
have any
absolutely.
issue, go to the person. Yeah. And
Because
Dr. Dan,
yeah,
yes.
I'll just highlight one or two facts. Seeing advertisements or recommendations from the social media or friends, I have a lot of people coming to me after applying, say, uh, garlic extract or onion extract straight away on the scalp or
Yeah.
face and come out with burns. So, or
Right.
say for that matter, simple things like tomato juice, it might or might not suit you. So I have experience of people coming out with burns, and those marks are permanent. Mark my words, those marks are permanent. That's very damaging. So, word of mouth does work well for most people, but a few people will face difficulties, and that is permanent. That is very difficult to treat.
Mouth of word may be helpful in finding a good qualified dermat. Use that there. It may help in finding a good doctor. And doctor, before we sum up the whole session, any take-home message for our viewers?
Well, I would recommend you to have a have four pillars in your life. Uh, First of all is food. Our Indian diet is very good. It has got seasonal fruits, vegetables, and uh, correct amount of carbohydrate and proteins. Be you veg or a non-veg or a mixed diet or a vegan, I don't mind. Number two is regular exercise, at least 15 minutes every day. Don't go by my body shape, but I do recommend it. And
Right.
number three is good sleep. In any religion, whatever it is, be it uh, be it Christmas, be it Shabe Barat, be it some Akhand Path, or be it some puja at night, maybe 5 days a week, 5 days a month, I mean 5 days a year, but 360 days, 10 to
Yeah.
4 is the best time to sleep. That kind of a sleep. People come and tell me I sleep 8 hours every day from night 2 to 10, but that is not proper. 10 to 4 is the
Right.
correct time to sleep. Maybe we doctors also can't follow it most of the times, but I would obviously recommend you something that is good. So 10 to
Right.
4 sleep, at least those 6 hours is enough. And number four is keeping a good mind. I mean, uh, A mind which is very peaceful, that reflects on your
Right.
skin. These four pillars,
Absolutely. Yeah, yeah. It will help you achieve a good life, good
because
lifestyle,
your
good
radiance,
health,
your
and
radiance reflects
healthy.
on your skin.
Absolutely, absolutely. And that's the whole motto of Radiance with You as well, to communicate as much as possible to our audience that how important it is to have a good lifestyle. Thank you so very much, Dr. Shamik. That was wonderful talking to you. Thank you for your valuable time and making this session so informative. Thank you once again.
You are wonderful. Thank you.
Thank you, Doctor. Thank you. It was a pleasure. So, this was issued in public interest by makers of Lulibol Lotion Advanced Genetics Division of Hetero Healthcare. Viewers, thank you for your active participation in today's session. Stay connected to our channel and do not forget to subscribe our channel, Radiance with You. Thank you and have a great day ahead.